Hello, this is Dr. Sunil Agarwal. I'm back with you for a little while. Hopefully this is working okay. I'm here in my kitchen table. This is my Patreon. This is for my Patreon account. I'm trying to get more thoughts out there about what I'm discovering as I'm going out into the world and practicing medicine in an integrative medicine clinic as an MD, as an allopathic doctor in a clinic with naturopathic doctors, and what kind of patients am I able to bring in, and how I'm able to integrate care for them utilizing what I've learned about the endogenous cannabinoid signaling system and its ramifications for health and ill health, and about the master botanical cannabis and how to utilize it to modulate the endocannabinoid system amongst other therapeutic modalities, and how to utilize psychedelic therapies in the treatment of severe conditions. Both of these modalities I have had opportunities to utilize and explore in the recent, since my last video with you. So I want to share some thoughts and observations. So number one, the endocannabinoid signaling system is not just some on the bulletin board, on the drawing board, on the whiteboard theoretical concept that has little bearing in hardcore, regular, on the ground, down to earth medical practice. No, cannabinoid signaling system irregularities and systemic issues seem to be quite widespread, and having an awareness of the nature of our endocannabinoid signaling system and how it ties together numerous physiologic systems, and its dysfunction ties into numerous linked conditions, helps to understand what is happening with patients better, improves diagnosis, and helps to guide treatment. So Dr. Ethan Russo, who was one of my PhD doctoral supervisory committee members, a number of years ago had coined this concept of the clinical endocannabinoid deficiency syndrome, and he wrote another revision of it maybe a year or so ago in the Cannabis and Cannabinoid Research Journal, which is an open access. It's a very good article. He talks about fibromyalgia, migraine headaches, and irritable bowel syndrome as the triad, the three signature issues that have helped to establish that these treatment-resistant conditions are all linked through endocannabinoid deficiency. But he does not stop there as the only conditions. He goes on to talk about endometriosis, post-traumatic stress disorder, Huntington's disease, neurodegenerative disorders, a wide range of medical conditions. And because we have challenges in measuring the endocannabinoids in a laboratory-based fashion, we have to use clinical markers at this time until we get set up to check blood levels of endocannabinoids or CSF levels or whatever tissue we're looking at. But what is fascinating is that clustering of hyperalgesia, pain everywhere, disturbed sleep, painful conditions due to trauma or injury that just take forever to heal, that sort of complex, plus alternating gut hypermobility and hypomobility, which can be manifest by constipation or diarrhea or intermittent thereof, what's been called irritable bowel, plus migraine headaches or heavy and painful menstrual cycle, dysmenorrhea, painful periods. They seem to they do seem to go together, and people seem to have one or more of those together. I think another aspect of this that's very interesting is what I call post-traumatic complexes. That is to say, people who have had micro traumas or repeated psychological traumas from family, social, or other environments. I believe, and this is based on my readings of the work of Dr. Bessel van der Kolk at Harvard, who wrote an excellent book, The Body Keeps the Score, that the body actually remembers and sort of translates the psychological traumas into physical misery and problems, because we're constantly in this mode of defense and protection from danger. And he makes a really interesting correlation that even immune system irregularity or dysregulation can be tied to a history of psychological trauma, and such that your whole body goes on a defensive mode, including your immune system. And if there's no major bacteria or viruses to fight, that immune system seems to target the self, the joints, which have got all kinds of seemingly delicious antigens to go after. And this is, I think, part of what happens with the autoimmune aspects of conditions that patients with trauma develop. So, in fibromyalgia, people frequently have joint pains. And, sometimes can have elevated markers of rheumatologic factors, showing heightened immune system activity and autoimmunity. So I think that the endocannabinoid system which by the way links the neurologic circuits, CB1 receptors and the endocannabinoids that bind to them, and CB2 receptors on immune cells. This system probably is part of the great link between the psychological and the physical, the mind and body, and I'm sure at some level spirit, in terms of meaning and purpose. And cannabis has long been used in spiritual practices around the world, so some aspect of that too. But this system really helps us stitch together the holistic view of a human being, of a patient, beyond just a mechanistic machine of molecules or just a complex of thoughts and emotions and experiences. So anyway, I think I'm seeing patients who have had various forms of trauma and fibromyalgia, who develop pain syndromes. I see that with utilization of cannabis preparations, they don't have to have super high THC. They can be CBD rich with little THC in them, like 5-to-1 ratios, and with dosing, with books like the CBD Dosing Guide that offers realistic weight-based dosing. You can see, I have seen several of patients who have long-standing, reduced mood, probably secondary to pain, or it's a vice versa, impaired sleep. I've seen them before my eyes get better with regular use of CBD or cannabis-rich products that seem to be boosting the activity of their endocannabinoid system, which might have been hypofunctioning. And that cannabis medicinal aspect application is not the only thing going on. When it's combined with other modalities that seem to further heighten the endocannabinoid system, like acupuncture, like osteopathic manipulative treatment, or other types of manipulation, like exercise, and perhaps maybe even mindfulness practices. I feel this is kind of the cannabis becomes an accelerant that helps to move up the activity of the system, and allows these other therapies to work better. And several times, people are making products in the Washington system that have other ingredients in addition to cannabis in them. So also utilizing this synergy amongst plants in the therapies. So I feel like I'm starting to kind of understand the way in which psychological traumas manifest into physical or bodily somatic dysfunction and impairment, and how modulating and targeting the endocannabinoid system for therapy can help to improve both the mental and physical aspects of these chronic conditions, and hopefully improve quality of life. So that's just a sort of series of thoughts based on real clinical experiences I've been having over the last, 5 months or so since I've started doing full-time clinical cannabinoid integrative medical practice, plus pain management, palliative care, and rehabilitation. I'm also seeing that I had an opportunity to treat a patient with ketamine lozenges who had severe PTSD. Um, and this is a patient I'd known for 13 years, because I had studied him as part of my early studies into looking at how patients with chronic illnesses navigated and discovered cannabis to help them manage those symptoms and improve quality of life with those conditions. And the condition in this patient's case was Crohn's. And I did a very thorough interview of a Crohn's patient of him all these years ago, looking at the discovery of it, the stigma associated with having a condition, and then using this, banned botanical that was misunderstood in order to heal himself. And it's amazing, he has stayed out of remission for so long because of, dialed in cannabis use, and has helped a lot of people with his knowledge, other patients. And by the way, now, which wasn't true back then, there are studies coming out of Israel. Dr. Naftali is a gastroenterology specialist in Israel who's done several controlled and observational studies of Crohn's disease patients using cannabis preparations, showing reduced complication rates, surgeries, and so forth, reduced use of steroids in patients using cannabis with Crohn's disease, which can be severe and cause people to get, colostomies and colon cancer early and all kinds of things. So it's really a remarkable thing, and his experience has been validated by this kind of research, or further underscored the legitimate validity of his findings. Anyway, but life happens, and numerous traumas befell this patient. Motor vehicle accidents, further destigmatization, being trapped into systems, and really developed severe anxiety. So on high dose SSRIs and psychotherapy, and just really no longer suicidal, but has been that way before. So he was interested in trying ketamine assisted therapy, and I can tell you, the first session was quite remarkable in terms of his ability to finally experience a mindset, a time when he's not on guard, when he's not anxious. He described it to me that he expressed tremendous gratitude and joy. It was tears. There was recognition of what's in the past, and recognition of allowing himself to have his own time to heal, and all kinds of validations. Very much. I mean, if it wasn't so cliche, but maybe there's a truth to it. Do you remember the scene from Good Will Hunting when Robin Williams, the late Robin Williams, rest in peace, is the counselor for troubled genius Matt Damon, and he's kind of helping him realize and say it's not your fault over and over again, as part of his therapeutic breakthrough about whatever in the past had happened to Matt Damon's character. in Good Will Hunting. And in the same way, my patient had this revelation, this insight that certain things that had happened to him were not his fault. He said that several times. Afterwards, he felt really good. He was noticing some increased tone in his body. He does have a cerebral palsy birth condition that can increase some tone. And I was doing a little bit of massage for him and got an opportunity for him to get a cannabinoid assisted topical massage after our session. And that's where I left him. So these are some of the stories coming out of my clinic and my own insights into take care of patients with trauma, pain, and serious conditions. I'm really also seeing so much fear and concern around patients who are appropriately using opioid therapies, who are being further cut off from their therapies. People who've had dozens of surgeries and severe, spinal cord issues. I feel like it's more important now than ever to take care of patients in a therapeutic alliance, destigmatizing way, and I'm hoping to continue to do more of that. All right, thank you for listening, and stay tuned for my next broadcast. Check out my page at patreon.com/humancenile and please support. Thank you.